All right. Welcome, everyone, to another episode of Pathways to Informatics, where we interview various informatics professionals about their career journeys to give students an idea of all the pathways that are out there. I'm your host, Brian, and today's guest is Dr. Ashwini Davison. I'm going to turn it over to Dr. Davison to do a brief introduction, and then afterwards, we can jump right into the question. So, Dr. Davison, it's all yours.
Great.
Looks like we might have a bit of lag.
Thank Where did you lose me, Brian?
At the very beginning. So we
At
want
the
to
very
go ahead
beginning.
and do
Okay.
it.
What do
Let's
Is this
give that a
better? Can
try.
you hear me now?
Yes,
Okay,
sounds
great.
good.
We'll give that a try, and then maybe if I'm feeling daring, I will jump back on. Okay.
Sounds like a plan. It looks like the connection might be still a little low on my end.
Yeah, I'm sorry. I'm going to try a plan B. I'm going to join from my phone. Can you hear me?
Okay. Mm-hmm. Let's try
Great.
that.
Okay, we're going to try this. Okay, it's going to be a plan B. It's informatics in action, trying different information systems, different technologies. Okay, so Brian,
Makes
you can
sense.
hear me now, right? Great. Hello, everyone. Ashwini Davison here. I am thrilled to be joining Brian in this fantastic session. So proud of you, Brian, for doing the LinkedIn Accelerator program. It's been great to see some of your different podcasts and fireside chats. And just so folks know, Brian was one of our all-star graduate students at Hopkins once upon a time, really excelled in the School of Public Health and as a clinical informatician with his strong pharmaceutical informatics background. So I was delighted when he asked me to join one of the sessions. So apologies for the technical glitches at the beginning. Incidentally, I am traveling for work right now, so I'm joining from Chicago. So am in a building and trying to join this session. So thanks for bearing with us. Like I said, I'm Ashwini Davison, physician informatician. I consider myself a polymath of sorts. Enjoy the healthcare space, the data strategy space, the business side, and really have always found different ways to take on opportunities that perhaps didn't exist either a few months or a few years prior to them presenting themselves to me. So really excited to have this conversation with you, Brian, and thanks for having me.
Well, thank you for being here. I was very excited when you said you were going to participate in this live stream with me because um, you're definitely one of my favorite professors there. Kept everything very interactive, and I think we're going to dive into your teaching interests and things like that. So I'm very excited to share your story with the audience. Um, so, all right, let's go ahead and get started. But why don't we start with housekeeping and an icebreaker question? So, for housekeeping, because this is a live stream, we have a list of questions that we're going to ask, but we do encourage folks in the audience to ask questions, and then we're just kind of, go back and forth with some of those questions to engage with the audience. But let's start off with the icebreaker question. So, if you had to choose a career where money is not an issue, what would you want to be?
Interesting. So what I would say is if I were choosing a career aside from what I have now, something outside of healthcare, big data strategy, one thing I always thought that would have been fascinating when I was growing up, loved sports, always watched ESPN, was a huge basketball fan. So being from Arizona, we always watched the Suns. I would have loved to be a sideline reporter for one of the big sports channels. So something like, an Aaron Andrews type role. That would be great. You get to travel, always have the latest updates, and see some great games. So that's probably what I would say.
Huh. Would not have expected that at all. Basketball is not my strong suit either, so I don't know too much about basketball. But
Mhm.
all right, let's jump into the very first question, and we're gonna take you back all the way to the very beginning, and let's start with your time in medical school at UCLA, with kind of the focus on the latter, where you were rotating through various practice settings. What kind of pathways were on your mind at the time?
Yeah, I would say UCLA was really the start of my interest in medical education, actually. So, Luann Wilkerson was one of our senior associate deans for medical education. She's now out in Texas at Dell Medical School. And she's really the one that got me involved as a teaching assistant for problem based learning. And I always was fascinated by, the medical school curriculum and the iterative approach to lectures in the classroom and then going on rotations. As far as what I wanted to do when I grew up, I really enjoyed my internal medicine rotation, thought about anesthesia for a while, knew I wasn't a surgeon in the making. But what perhaps fascinated me the most, even though I didn't know it at the time, was this would have been around 2003, 2004, 2005. We were mostly on paper and information exchange and the ability to know everything about the patient was challenging in a different way than it is now. But during my family medicine rotation, that was the first time as a third year medical student where the preceptor at this particular clinic was asking me about a patient with diabetes, what was their hemoglobin A1C, et cetera. But that particular clinic had gone to provider order entry, so they had a system, but as medical students we didn't have access to that. So all of a sudden that was my first time where every other rotation I could look up the paper record and find the information, know the patient's history, but here I didn't have access or insight into this longitudinal view. The preceptor did, but from a systems change perspective, all of those different issues of information silos, who has access, who has permission, what's the role of the medical student, it hadn't been thought through. And that was just the beginning, right? This is before the Affordable Care Act, before, the High Tech Act. And that was such a frustrating experience. Here, I wanted to know about the patient. I could ask them questions, but I couldn't answer a preceptor's simple question because I didn't have the screen in front of me. I would say that was probably a turning point for me, even though I didn't know it. In my interest in informatics, systems, data, interoperability, information exchange. And so I ended up going into internal medicine and moved across the country. But I would say I really enjoyed my time at UCLA. It's really what started my passion for medical education and then also my budding interest in clinical informatics.
Okay, and this is a very nice segue into the next question. But before that, I will say I do have some experience with paper charts too. So I remember some of those days of going there and writing inside the charts and just doing your research on patients before rounds. Um, so the next question is going to be a very interesting one because you're going to be kind of in the heart of it. So as you mentioned, you did your internal medicine residency at Johns Hopkins. And I was listening to one of the podcasts you did last year on Futural Health, and you had talked about how it was very interesting of a time during your residency because it overlapped with high tech in 2009. Can you kind of describe to me, what that experience was like, especially as a frontline provider?
Sure, absolutely. So, working in Baltimore, being an Osler internal medicine resident, lots of long hours, amazing experience, wonderful colleagues, amazing patients in Maryland, and dealing with 5 different information systems, 5 different, approaches to provider order entry, not having the training in place necessarily that was needed for, what a resident should be doing versus an attending versus a fellow. It was all just such a interesting time for someone who likes to take a systems-based approach. I just always felt that things could be done more efficiently. There had to be a better way, even though, the digitization of health records was this big ambition. The way everything happened to the frontline providers, the way it trickled down, all of the systems, there was so much chaos, and it impacts patients, it impacts providers, it impacts, all of us. And for me personally, I would in some ways refer to myself, having gone through that, as the era of clinical burnout, before clinical burnout was a buzzword or a phrase. So for me, I wanted to be a part of the other side of the equation that maybe was leading change through, in the future. And those experiences of moving around from one system in one hospital to paper over here, another system, the usability challenges, the lack of training, all of that really drove me, post residency towards a career in informatics.
Okay. Yeah, I just hearing you describe it reminds me of the time when there's paper and electronic systems and it was just all different. So I can imagine practicing at that time must have been a little frustrating, and maybe a bit of burnout too. Let's move on to the next question. So your first postgraduate position was a medical director at Inovalon, which is a health IT consulting company. And I actually thought this was very interesting. Imagine landing this role probably was related to the experience that you just described, where you're using different information systems you dealt with as a resident, and then the timing related to the Affordable Care Act funding. So a couple of questions about this. First is, can you tell me more about what was involved in this pathway that you pursued a position at Inovalon?
Yeah, great question. At the time, the company was called MedAssurant. Interestingly enough, it was founded by a former Osler resident. So Keith Dunleavy was the president and CEO who had started MedAssurant. My first boss there, Paige Killian, she was also a former Osler resident. So lots of Hopkins ties there. And Keith Dunleavy was just a visionary and really had this amazing, was the tip of the spear, right, in integrating different data sources, deriving actionable insights from them. And so it was a great opportunity that presented itself to be a medical director. And what I got to do is work with healthcare claims data and mine that data to find patients with diabetes who might benefit from a particular outpatient intervention, or identify the patients that were most at risk for hospitalization and come up with a way for a case manager or some other, higher level of intervention. So I was really in the weeds with the data, and it was an amazing experience. Got to work with other physicians on the team who were young moms like myself with a passion for healthcare data. And what I would say about that time period is it was before value-based care had become a commonly known term, and a lot of what we were dealing with was helping health insurance companies improve their quality, improve their care delivery by digging into the healthcare data. And so, yeah, that was my first job, and really amazing experience there, and really was the start of my work in defining clinical algorithms.
Okay. So it might have been a personal connection that might have influenced that decision there then.
Oh yeah, so that's a really great question. I actually no, I didn't know them beforehand. And
Okay.
so yeah, it was almost it was a company that was based out of Maryland, but I was looking for opportunities at the time that would allow me to have that combination of my interest in analytics, big data in healthcare, and there was just this great role, and so I interviewed for it, and it was the right time for me to go over into industry. So really grateful for that. But yeah, no, I didn't know
Hmm.
Paige or any of the other individuals on the team prior to applying.
Okay. So all based on the merits and good performance that you had.
Right. Yeah, no nepotism there.
Yeah. Okay. So yeah, one of the focus areas that you had in that role was the Medicare Advantage risk adjustment and star ratings. Given the relationship between documentation burden and clinician burnout, what were some of your thoughts at the time when these programs were rolling out as part of the Affordable Care Act?
Yeah, that's a great question. So a lot of my work was on the back end, right? Mining the data, finding actionable insights. But there are so many programs and so many ways that the system has tried to ensure that reimbursement is appropriate, that providers are capturing all of the data elements that they need to capture. And risk adjustment is one of those programs that was developed, in the Medicare Advantage Part C plans on the capitated model. They were trying to utilize these codes and still are for identifying severity of patients. And based on that, the capitated payments would be made. But at the time, and even now, providers aren't incentivized in certain ways to code with a certain level of granularity. So what the focus of companies like Inovalon was at the time was to go in, find those gaps in care, find those gaps in documentation, and have nurse chart abstractors identify those gaps and perhaps remedy them so that the capitated payment would be addressed. What I would say is so many different models and approaches to care have been have been attempted. And a lot of this does lead to documentation burden and increased frustration for providers, right? EHRs were supposed to be the solution once we moved off of paper, but even there, structured data fields, there isn't the usability that's needed, there isn't time for visits, and a lot of unstructured free text is there. So maybe NLP will be the solution. I think we, keep trying to iterate on different approaches, and there's no perfect solution, but that was a little bit of the work that we were focused on then as far as Part C risk adjustment.
Okay. And as you were describing it, I was just thinking like, there's a lot of challenges, but we definitely have a lot of opportunity to improving this documentation burden and addressing clinician burnout.
Yeah,
Um,
yeah. Lots of things, have been tried over time, right? The concept of medical scribes or
mhm.
improving, provider order entry, making systems more usable, having individual clinical decision support committees. But, we're not there yet, but folks are going to continue trying, and lots of attempts are being made to improve that experience.
That's why it's a great time to get into informatics.
Yep, yep.
Okay. In next question, in 2021, you did a podcast with the CEO of Futuro Health. And during that talk, you referenced starting your own consulting company, Informatics Advantage. What were the motivating factors that you that made you take that leap into starting your own consulting company?
That's a great question. I really enjoyed my time at Inovalon, and then I had my second child, and so all of a sudden I had a 2.5-year-old, and I have a newborn, and I knew that the travel involved with a medical director role like that would have been something that would have been challenging with the two kids, and I wanted to be able to spend more time at home. So I uh, that's really what motivated me. So I was a women-owned small business and a sole proprietor. And the very first customer that I got to consult for was my former employer. So, it was just wonderful. My boss at the time, Paige Killian, who I mentioned earlier, was a really strong physician champion and really a great mentor for us young mothers that were in this field. And so one thing after another, was able to take on roles where there might be a project that needed a physician informatician, but the company might not have needed a full-time employee, or it might have been something where there was really, there weren't too many of us with this particular skill set who were familiar with all of the, at the time, ICD-9 codes, CPT, ERGs, who could mine that data. And so that's really, the motivation to be with little ones, have some flexibility, but still continue to stay active in the field is what, had me launch that company.
Let me just say that I'm like really impressed because if I was in your shoes at the time, I would have thought about applying for a job, not starting my own company, which is in itself a challenge, a huge challenge to start your own company.
Right. Yeah. No, these were not things that I learned in med school or
Yes.
residency. But there are a lot of resources. And what I
Hmm.
would say is, based on if anyone's interested in pursuing this, look at your, state, local incubators. There's lots of health tech groups. There are many people in the startup community, or other resources at the state level too. Small business administration that can help you get started. And it really depends on what you want to do. I wasn't looking to create some company, hire talent, and grow that. I was looking to be the subject matter expert that could help other companies as an independent consultant. And at that time in my family's life, it was the right thing to do. So that's what my motivation was. I would have never guessed that that would have happened, right? I sort of mentioned earlier on, Brian, that most of the roles I've taken on didn't exist a few months prior or years prior to me taking them on. And that's where I think the biggest piece of advice that I would have for anyone exploring the field of informatics is to just keep learn and be curious, and know that opportunities will come your way, and there won't always be a rule book or a guidebook or a precedent, but have confidence in yourself that you can make it happen, and take that leap and things will work out.
Excellent advice there. And there are two comments that came in. Before we go to those comments, though, let me finish with this topic and we'll get right
Sure.
to it. Um, so it looks like you continue to consult over the years, but according to LinkedIn, you may have stopped in March of this year. And two questions on this. The first of which, over the span of all these years, what was the most challenging project that you worked on?
Ooh, that is a great question. I would say that it was at the time I was a consultant for iPro, which was one of the quality improvement organizations in New York, and there was a big project that for CMS where iPro was subbing to Brandeis University. Booz Allen Hamilton was involved. There were individuals from HCI3 and Acumen, and it was to design the episode grouper for Medicare. And I would say that that was a fascinating project where it was a lot of different clinical subject matter experts that were a part of it, refining these clinical algorithms to identify the right patients with certain chronic conditions who would be utilized in EGM, the episode grouper for Medicare. And perhaps what was so challenging is, it was an amazing experience, but there were so many different groups involved all around the country. We were all involved in designing these episodes. There's different frameworks for, these payment models. There's different approaches to defining disease, and, reconciling all of the different opinions, going through the literature, identifying the right subset of patients, digging into the data, iterating. I would say that was perhaps one of the most challenging, but also, rewarding experiences during my time in consulting. That was a very big project, and led to one other thing that I'll mention, because folks are on here who are interested in pursuing a career in informatics. Because there were so many folks involved and we created these relationships, that type of networking relationship is something that can lead to other opportunities down the road. So I would just say that in anything you take on, don't burn any bridges. you never know where someone's going to go who you work with, right? And they might end up remembering that you were that person who might be able to fill a void in their future pathway. So always keep those lines of communication open. That project was rewarding, intense, and very, collaborative with multiple different groups. And all of them have gone on to other organizations or other groups. And we've always been in touch. And that's led to other opportunities for each of us. So I just wanted to touch on that since we're talking about pathways to informatics, Brian. It's not just the entry into informatics, right? But the career path that you take once you're in it. And there's always pivots and turns. And I would say that networking is a very, very important part of, being successful.
Two comments. The first is that oftentimes it seems as though the most challenging projects are the most exciting. Seems as in this case. And the second thing, to even add on to the don't burn any bridges and networking, I think some of the best opportunities I've had actually came from my time at Hopkins during my MPH. I've had so even including yourself, you've offered me a lot of unique opportunities for me to pursue, and I think that is advice that I always give my students as well.
Yeah. Brian, it's interesting. Isn't it amazing that when you were probably in your final year of the MPH, would that have, or maybe, I can't remember, we met at the AMIA conference in DC. And I always recall that so fondly because it would have been November of 2019. Wow, we wouldn't have guessed right that would have been the last in-person conference we'd do for some time. Isn't that fascinating? Like, being down at that the Hopkins social hour and having other grad students come, and little did we know that a few months later everything would shut down.
It honestly felt like yesterday when we were still doing that. Time, it's been a blur the last 2 years, but yeah, it's bittersweet, if anything.
Yeah. I remember you were there. I think it was at the time we had just finished in November. I think we were it was during second quarter, so the leading change through health informatics course would have been running at the time, and a few of you that were in the course came, and there were faculty there, and there's this big nationwide symposium. I'm glad that hopefully this November it'll get to happen again in person in DC, because it will be nice to see folks again after a 2.5 year hiatus. But I think that one of the things that I would commend you on is, as a graduate student, even during that time, you made sure to take advantage of opportunities outside of the classroom, right? You were doing your assignments, you were posting on the discussion forums, you were taking your quizzes, but you also made sure to take on other projects and really make the most of your time there and network. So kudos to you.
Yeah, thanks for that. Always networking. Networking is always a good thing. So I try to do that whenever I can. All right, let's look at some of these questions and comments we have here. First one looks like it's just a comment. Love this LinkedIn discussion on crossing the data chasm. So much opportunity for improvement in healthcare tech. And the next one is one from Carrie. What are your thoughts on Mark Cuban's online pharmacy?
Right. So remember, I told you I'm a Suns fan. So anything having to do with Mark Cuban, right? Dallas Mavericks comes with an asterisk. That said, I think that anyone who is attempting to lower the price of medications, the steep price in the pharmaceutical space, I hope that they are successful, right? We'll see. There have been lots of attempts in this space. It really does take a multi-pronged approach. I think that when individuals like Mark Cuban, when he announced the opening of his online pharmacy, it created, a big splash. But if there's any way we can find to avoid high drug prices and help patients and reduce that surplus cost, I'm a big proponent of it. Time will tell if it's successful or not. Brian, I'll say that one of the things we tried, separate from Mark Cuban's online pharmacy, but one of the, attempts that we made that was a really big project that I worked on during my time at Hopkins was introducing the real-time prescription benefit support tool into the Epic electronic health record. So the national count, NCPDP has, at the time it was the beta standard for RTPB. We had gone live with it in Epic in July of 2019 at Hopkins. And, at that time as well, sure, you have a tool, it's going to provide some price transparency. But as the informatician, my job was to work with Danny Lee, who was CMIO at Johns Hopkins Community Physicians, Jessica Mary, who was a PharmD and did some great work in the ambulatory space at Johns Hopkins Community Physicians. We worked together to validate whether the prices being displayed at the point of ordering were indeed accurate. And so over the course of a few years, we had to aggregate data not just from Epic, but also from the outpatient pharmacy in order to validate what the patients actually paid at the time of the transaction, because that wasn't being captured in the EHR. So, just related to, I think it was Carrie that posed that question. Anything that's launched that can lower prices for patients, I'm a big fan of, but ultimately, we have to see the data to see if things are really working. So always a big proponent of validating what's implemented. And the RTPB example, the outcomes, we're still waiting to see if there's an impact on clinical outcomes. A lot of projects are being done around social determinants of health. One good step that we were able to take care of is, validating the accuracy of it. So that was something that I was proud of at the time.
Yeah, and I know for those who might be interested out there, NCPDP did publish like the final summary and report of all the great work that you guys did on that project. So highly
Yep.
encourage folks to check that out.
Yeah, and I agree with what Carrie's saying about exactly. It's not just about reducing the cost, though, but ensuring the quality and not just lowering the cost of meds. So yeah, great point. Great point, Carrie.
Okay. And you want to take one more question here?
Oh gosh, that is so interesting about pharmacogenomics. Certainly not my area or wheelhouse. But what I will say is, in general, regarding integrating any types of clinical decision support, this is where I think that any types of genomics, there's the technology aspect, there's, the FHIR standard's going to be important for this. And it's not just about having the data appearing, being able to share the data, having it, be meaningful at the point of care. But I think we have to go all the way back to training and education so that providers of any type know how they can actually utilize that data. So I think anything related to genomics data of any kind, we have a lot of work cut out for us before we're able to, truly make this a standard part of care. So great question.
Okay, let's turn back to your time in consulting, and then we'll ask one final question about that. And that is, for those who are considering, starting their own consulting careers, what would you say were some of the biggest lessons learned during your experience?
Yeah, that's a great question. What I would say is figure out what your value proposition is, right? What are you offering that folks might need? And how do you define that? How do you clearly come up with your brand and what it is that someone should offload to you? For your consulting services. I work with a lot of folks who are thinking about that transition from a full-time role to perhaps being a, independent consultant. And I think it's important to figure out, Brian, why are you doing that? Is it because you're dissatisfied with your current role? Is it because you're looking for some types of flexibility? Is it because you're just curious about, what consulting will look like? I would say defining your value proposition, making that clear so that folks know what to come to you for, but also so that you set your own boundaries. Sometimes, you can be drinking from the fire hose and all of a sudden, the role that you left that might have been super busy, you went into independent consulting and you're drinking from the fire hose again. So be clear, with yourself. What are your goals? What are you trying to achieve? What type of balance are you trying to find? What makes you, what makes you happy? What lets you have passion? I think that's also super important to factor in.
Yeah, really starting with that why and that purpose behind that
Yeah,
decision.
yeah, it's really important, right? For some people, it might be, you know, having the time to do X, Y, and Z. For others, it might be just having the independence to call their own shots. And for others, it might be flexibility. So being clear in why you're doing the consulting, what your goals are, is really important because it's not the same for everybody.
Mm. Okay, so we're going to pivot a little bit to another position that you held at the time. So you launched your own consulting company in 2015, but then you also became an assistant professor at Johns Hopkins School of Medicine, which you're still presently affiliated with. Two questions here. The first is, can you tell me more about how that kind of happened? And perhaps was that part of your original plan?
Yeah, great question. I would say, I was always passionate about medical education, dating back to my time at UCLA, like I'd mentioned. And because I'd trained at Hopkins, I was going back and helping with certain medical student courses. And what happened is, at the time that I got my board certification in clinical informatics, I reached out to Harold Lehman. He was the godfather of informatics at Johns Hopkins. Harold has been a mentor to many of us, and I mentioned to him that I'm interested in teaching and that, I, had a clinical informatics background. And bit by bit, Harold was such a wonderful mentor to me, brought me into courses that he was teaching, gave me opportunities to help introduce applied clinical informatics concepts to students, and started off with helping out with his annual first year medical student course, Time Clinical Informatics, that Steve Miller is now directing, and then got more involved with the master's program. This was at a time when online education was really revving up, and just one opportunity after another. And then right after I got involved with the informatics program, Mark Biddle in the School of Public Health was launching a population health management master's and certificate program. So bit by bit, new opportunities presented themselves, and I just really enjoyed online education. In many ways, Brian, it's because for folks that were looking to make a professional pivot, but needed to continue working and couldn't be in a full-time on-campus program, or for others who were trying to upskill or reskill, the ability of strong programs at Hopkins in the School of Medicine, in the School of Public Health to offer these flexible part-time programs to learners. I just loved the students who were coming in because they knew that they were hungry for something more that they hadn't gotten in undergrad or their master's or med school. And it just was a tremendous opportunity. So yeah, bit by bit, it evolved. And before you knew it, I was full-time faculty at Hopkins.
Everything kind of works out, it seems. And I was thinking about the podcasts that you did with Future Oral Health and how the online education really was like a great thing that you helped embark at Hopkins, because you did all this work with online education and the pandemic hit and everything just kind of worked out from there. All that work just was good.
Yeah,
Um,
and actually, Brian, to that point, what I would say is it is interesting because health system science is, the third pillar of medical education, right? Traditionally, we think of basic science and then clinical medicine, but the American Medical Association has been pushing for HSS, health system science, to be integrated into the curriculum. So it was a unique experience for me to have the informatics background, have the health policy background, patient safety, this interest in, health system science. Got to become an AMA Health System Science Scholar, thanks to Maura McGuire, nominating for me for a few roles. She was a strong mentor of mine from Hopkins. And then you're right, the pandemic hit. And that was perhaps one of the most rewarding times of my professional career, as challenging as it was. Um, because I'd been at the forefront of online education before it became the norm during the pandemic, I got to move over from supporting the graduate student programs in the School of Medicine for a while to being all hands on deck supporting the undergraduate medical education program, UME program, the med school, early into the pandemic. So was part of that core group with the Office of Online Education, the Office of Academic Computing, the Office of Medical Student Curriculum, in making sure that the MD curriculum stayed online, helping enable some of the faculty that weren't familiar with tools that others of us in online ed had been using for many years. And so that was definitely one of the, the busiest few weeks of my life, and supporting some of the clinical faculty who might have been teaching a course, but were in the ER dealing with COVID patients, the, influx. Brian Garibaldi had been my pulmonary fellow once upon a time, and here he was, getting the biocontainment unit going during COVID. So, of course, it was the right thing for me to do to step in to help out with the course that he'd otherwise be running. Brian needed to go and be at the front line of care, and I was able to help support his medical students by converting, that curriculum to being online. So, yeah, that was definitely a time period where the confluence of all of my interests and career experiences really came to be of value.
And being on the other side, taking a lot of these online courses from Hopkins, it was definitely a good experience on the student side of things too. So it worked out. You mentioned that you got board certified in clinical informatics, and I guess a question on that. I have a few colleagues who are physician informaticists, but aren't board certified in clinical informatics. So I'm just kind of curious to hear your perspective on, what is the value proposition there, and perhaps what was your experience getting board certified?
Yeah, great question. So, the American Board of Preventive Medicine approved clinical informatics as a subspecialty if you have a board certification in a primary specialty. So for me, it was internal medicine. So yeah, back in 2014 or so, I was part of that second cohort that took that exam. There are a few ways to qualify for it, and I qualified through the practice pathway. And most recently have had a lot of physician colleagues reach out of interest because the practice pathway did get extended. So I wanted to mention for those of you, originally the practice pathway had gotten extended through 2022, after which a fellowship would need to be completed in clinical informatics. Based on COVID-19, knowing the pressures that folks have had, the practice pathway has been extended for another 3 years. So if you're interested in taking the clinical informatics, boards, there are options such as getting a master's program. And obviously, anyone who knows Paul Nagy, a great resource. He's currently the program director for biomedical informatics and data science, the master's program at Hopkins. Absolutely reach out to Paul. The entire team there is happy to speak to folks about options there. Others can qualify for the practice pathway based on a certain amount of their time at work over the past few years being in the domain of informatics. And then, of course, there are clinical informatics fellowships and some great programs around the country. So happy to talk to anyone about what those options are. I'm actually, really thankful that this became a subspecialty boards. If you look at certain job options these days, right now at Hopkins, there's an associate CMIO role for Johns Hopkins Medicine. You'll see that as one of the preferred qualifications. So for physicians looking into this, certainly encourage you to explore, the many different pathways to getting board certified in clinical informatics. And
Okay.
happy
Yeah,
to
thanks.
discuss online if anyone's interested.
Yeah, thanks for sharing your experience. And definitely contact Dr. Davison if you have more questions. Let's move on to another part of your career path here, and going specifically to 2016, which I thought was a very interesting year. You were involved in many different things already. You became involved in more things. And so you were doing consulting, you did teaching at Hopkins, but then I noticed like kind of a trend where you were involved with a lot of different startups, it seemed like. So, for example, you were chair of the Health Tech Innovators of Central Maryland. You were also an advisor for Medvensis, which for the audience here is a cloud-based analytics technology and clinical and financial outcomes for healthcare organizations, which was later acquired by Avalent in 2018. You were also a clinical advisor for Livongo, a digital disease management company that was later acquired by Teladoc. And then you were also part of TEDCO's executive loan program. And I think it might have been like the first cohort, if I recall correctly, or the second cohort, something like that.
Yeah. So yeah.
So, first question here is, can you tell me more about the motivating factors in getting involved with these startups?
Right. So some of those were related to the consulting company at the time and opportunities to support. As far as Livongo goes, previously I'd consulted for Castlight. And actually, this is a really great story. So earlier, we talked about the episode grouper for Medicare and how I had done that work as a consultant for iPro. Daniela Pearl-Roth, who was at Acumen at the time, had introduced me to some folks at Castlight, based out of the Bay Area. And there was a consulting opportunity there related to some algorithms that they were working on using various, data sources. And then at the time, the chief medical officer at Castlight, Jennifer Schneider, became really good friends with her. Jenny went on to Livongo, and there she, reached out to me again and said, "Hey, I'm with this, amazing new startup. Could really use your skills with some, data sets and, algorithms." So I worked with Jenny there, Livongo, then became a clinical advisor, supporting some of their strategy. Then Livongo was acquired by Teladoc, and here we are today. So I would really say that, Brian, there was no roadmap, there was no plan from, the get-go, but one opportunity really does lead to another. And if you have a certain skill set that's in a niche space and demand is greater than supply, it's a good time to be a consultant in that space. So the question you asked about the Health Tech Innovators of Central Maryland and my work with TEDCO, those are both groups that are fostering local ecosystems of innovation. And so I would say that giving back to that community and helping others network in that space was really important and meaningful to me. And that's why I got involved with those. I'm still involved with TEDCO. I think it's great that they support commercialization. I think it's really important. And another comparable group that's doing that to foster the local economic ecosystem in Maryland, Chesapeake Digital Health Exchange, led by Mark Comiskey, started at Hopkins. Lots of great work going on, but yeah, that's a little bit about the startup ecosystem and, the work that I was involved with there.
And it seems as though, having those connections and networking really plays a huge role in it. But also, the fact that you did a good job on one project is what leads you to another one too. A question perhaps related to this whole topic of startups here from Carrie, for pharmacists who want to break into digital health and medical startups. What would be your recommendation?
Yeah, that's a great question. And so what I would say is, Brian, I'm sure you have some thoughts on this as well, because you have a huge ecosystem of colleagues in the pharmaceutical space. What I would say is there are so many online courses and ways to upskill and reskill. I would say that a good place to start would be whether it's on LinkedIn or going on to Coursera and checking out some of the offerings there in digital health. Jumping on to Meetup, finding some of the networking groups in your local space that have sessions where they're bringing together other innovators. Those are some good ways to get started. And LinkedIn is a great platform for meeting others. And I would also say, check out some of the companies that you might be interested in the digital health space, and look at what the job postings are and what the applications are looking for, and see if that skill set is something you already have. And if you don't, what's the delta that you need to address in order to get there and close that delta. But again, going back to what Brian and I were talking about earlier, network, network, network. It's about what you know, but also, who you know, so that folks can call on you when the opportunity is there. So those would be a few of my tips, Carrie.
Yeah. The only thing I might say is in the pharmacy space, when most of us think about digital health, we also think about one individual whose name is Timothy Angst. And he's done a lot of consulting opportunities for digital health, just like yourself, Dr. Davison. And someone I would reach out to, network, value proposition, everything you mentioned. Same thing I would say to Carrie as well. So, right. Let's move to a related question on our list here. Given your experience working at the forefront of innovation with Livongo and Teladoc, especially since it was both pre-pandemic and during the pandemic, can you tell me about what it was like working on these digital initiatives, especially as the world shifted virtually?
Yeah, that's a great question. So, Brian, I talked a bit about, the online education work and how there was just so much chaos and confusion and these new skill sets that needed to be gained. I would say that there were individuals at the tip of the spear prior to the pandemic that were working on these digital health approaches and telemedicine and that innovation. And then when the pandemic came along and reimbursement changed, that's when really, folks had no choice, right? The adoption was there and it was trial by fire, but it needed to be done as brick and mortar was shut down. And now we're in that post pandemic phase and we're going to figure out what was, where are the rates going to really end up for telemedicine adoption. I think that all health systems are undergoing digital transformation in one way or another, but digital health is easier said than done in some ways. And there are a lot of changes that need to be made from an education perspective, from an implementation perspective, from a reimbursement perspective. So the next few years are going to be really fascinating. So telemedicine's not going away. Digital health and the concept of a digital front door for health systems is not going away. But just with any other type of change in healthcare, it's not just about the technology, it's about the people, the culture, the transformation. So the next few years, there's just going to be a huge need for individuals who have that clinical experience, that healthcare background, but are also comfortable with the data and the technology. So uh, really fascinating time to be in the space that we're in.
I think I learned a lot of the importance of leading change and managing change from your class, actually. The importance of that. The quote either was like 10% technology and 90% people, something like that. So it's really important to focus on helping people and leading them through change, which great segue to the next part of the question, which is primarily about your involvement in teaching and being a professor. I'm actually going to skip some of the more formal questions and ask you more of a fun one here. But let me give a bit of a background. So you're already an assistant professor at Hopkins since 2012. Looks like your academic responsibilities increased quite a bit though in 2017. You took on an associate director of education role for informatics education at the Johns Hopkins School of Medicine. And while also doing that, you took on an associate director role for population health management for the master's certificate at Hopkins the very next year. So, skipping some of the more formal questions and getting to something more fun here, you were the recipient of the Excellent in Teaching distinction 6 times, where you were course director for 2 of the courses in population health management curriculum. As your former student, and honestly and truly, I really enjoyed the courses that you put out because it was very different. It wasn't just a lecture; it was interactive. It was different formats. I'm not surprised that you had all these awards. But from your perspective, can you tell me more about what you love the most about teaching?
Yeah, that's a great question. So I'm a big proponent of active learning experiences, right? You mentioned, we're all used to passive learning and the standard lecture, but we know that attention spans don't last more than 5 minutes, 8 minutes. And so that's where I think that active learning approaches are so valuable. I'm also a big believer in experiential learning and on the job training. And so I would say that my most rewarding times as a faculty member were when students who had taken a course would come back and tell me about a time where they applied something from the course directly into their work. So again, being involved with a lot of part-time online degree programs, these were working professionals. And so the best stories were ones where someone could come in and say that Gantt chart, I utilized one for a project the very next week. Or, wow, we're really leading this huge systems change, and tackling a readiness assessment, an organizational readiness assessment for change was really important because we realized the culture, the systems, the executive buy-in wasn't there, and we shouldn't, move forward with this particular technology till we get more buy-in. So yeah, I would say all of the examples, and there were many of them, Brian, where individuals were able to take the lessons from a course and incorporate them into their work, but then also took the time to come back and share that story. Those were definitely some of the most meaningful ones, because everything we're doing in informatics, it's in real time, right? It's all relevant. Health system science is so important, so valuable. That's what I would say.
Mm. Well, to add to that, then I can say that I used the swim lane diagrams that I was taught to help in doing workflows for our antibiograms at my institution. But a
Okay.
very important distinction was the way you had taught us was to have like a high level one, like a very basic one, so people can quickly get the idea, but then a more detailed one where you can go through all the steps and details. And my stakeholders loved it. Very simple, easy to read, and that's something that I used. That was last year, so it was super
That's
awesome.
great, Brian. Yep, yep. All of those tools, right, come in handy. It's about knowing that the tools exist and being able to, pull from your toolbox, if you will, at the right time for the right purpose. It can really be transformative in a project. And so, great. Thanks for sharing.
Oh, yeah. So we're gonna go to one of the last parts of your career before going to some overarching questions. So from listening to the Futuro Health podcast, it was quite obvious you had a very strong interest in artificial intelligence and cloud computing. And so it's very, very exciting to me to see that you took a position with Amazon Web Services as a physician executive academic medical center. So, a couple questions here. The first one is, can you tell me more about, your decision in making this move?
Yeah. So, you mentioned earlier about how things can come together based on a variety of different experiences. So, in my professional career, had been involved with healthcare, with informatics, with the industry side of things, and it was during the pandemic, the academic medical center vertical at Amazon Web Services was really growing and expanding. So there was an amazing opportunity to support academic medical centers in the Northeast and Mid-Atlantic region. So I was thrilled to join the team. And it's great because I get to work with several other physicians who have strong informatics backgrounds. And we are supporting other faculty members at health systems who are trying to lead change through cloud computing. So the traditional data center approach, the on-premises infrastructure, migrating to the cloud is easier said than done. It's not just the click of a button. There is a lot of modernization involved, and there's a lot of training and enablement. So it is just amazing to be able to work with clinicians at these health systems, bring technical resources to these faculty, think big with them. So I'm very much enjoying my work here. Yeah, I'm an executive healthcare advisor, and in that role, I get to support the working backwards process that Amazon uses. So working with the academic medical center, meeting with their clinical leadership, helping their executives think through what their goals are over the next 2 years, 3 years, 4 years, 5 years, working backwards from there. And it's been fantastic, both in the research realm and supporting clinical workloads as well.
It's a very cool position, by the way, just to see it. It's very different than what we traditionally think about, being in hospital setting and things like that. So very, very cool position. Now, what has been the most surprising thing you've encountered during your time with Amazon thus far?
Right. I would say the most surprising thing has been the breadth of domains that Amazon's involved with in healthcare. So I'm part of the academic medical center team, and then there's others that support nonprofit healthcare. There's the Amazon Care side that's working on actual care delivery. So just the breadth of areas within healthcare and the many different approaches that Amazon's taking to supporting patients, providers around the country. It's really been amazing to see. And, I'm one sliver of that, which is a sliver that's, very much in my wheelhouse, the academic medical center space. That's, my, that's where so many of my experiences have been. But there's just a lot going on.
Okay. And now for other physicians looking to get into similar roles at Amazon, what would you say to them?
I would say check out the job postings, right? The site. See if there's a good fit for you. Use the search terms like healthcare. Feel free to contact me. Happy to talk to you about what the culture is like. Happy to see if this is the right time for you in your career. Have those types of conversations all the time. So always feel free to reach out. And whether it's here or at another organization, I'm always happy to mentor people, provide them with connections, talk to them about what their next professional pivot will be. A lot of individuals have helped me over the course of my career when I'm, making that next big decision or thinking about, what's on the horizon. So always happy to return that favor. I think that's important.
Okay. So a couple questions to wrap up this interview. Um, the first one is, what has been the most impactful thing or things you think has made you successful in your informatics career?
That's a great question. And what I would have to say, without a doubt, is my family. So my parents and my brother are so supportive. My husband, Andy, has just always been such a trooper, really. He every step of the way has, known that, okay, Ash is about to do something different. Here we go. And has just been the biggest cheerleader for me. So I think having that support system has been invaluable because, especially when you're in a space where there isn't a precedent always, or it hasn't been done before, it can be daunting. But having a support system, and then, my kids are just, wonderful champions of mom and her health informatics career, whether it's been in the education domain, industry. So I would say having a strong support system is super important.
Highly, highly agreed. Love that. Um, if you were to go back in time, what would you have wished you had known when starting off in your career?
Wow, that's a great question, Brian. And what I would say is that it's okay to not have. I think it's back to that same thing. I would have liked to know that it's okay to try something that's new, and even if there's no precedent for it. If you've done your homework and you're making a data-driven decision, and you have the ability to learn and be curious and adopt new skills, things will work out. So having that flexibility and the ability to adapt to new environments is what will keep the opportunities coming your way. Um, you don't have to have learned everything in undergrad or med school or residency, right? As long as you have that willingness to continually evolve and adapt.
Okay. What has been your most challenging time in your career and why?
Oh, that's a great question. What I would probably say, Brian, is that it probably hasn't come up yet. It's probably, I think that we're undergoing a lot of change right now post COVID. And I think that the biggest challenge is probably one that, I haven't even dealt with yet. So the next few years will be interesting as we see this digital transformation underway. So I think that's going to be my answer, that I probably haven't faced the biggest challenge yet.
Hmm,
It's probably coming.
I love it. You're the only person that have given that type of answer so far. That's exciting. Yeah. Last question. What advice would you give to someone that has an interest in clinical informatics?
I would say join the American Medical Informatics Association. AMIA is just a fantastic organization. If you're going to, go to any of the conferences, I would highly recommend the annual symposium, DC, later this year, like we discussed. The quality of the sessions there, the types of individuals you'll interact with, the hot topics. Read Jamia, stay up to speed there, know what is going on in the academic circles, where the areas of focus are in research, and find a mentor. Find a mentor. And the mentor doesn't have to be someone who's in a job in informatics that's exactly like what you want to be doing. You might not know what you want to be doing, but find a mentor who can shepherd you along and, be a sounding board for you. And those would be my biggest pieces of advice: the professional society and then having a mentor.
Okay. We have a comment here. It doesn't show up on this platform, but I'm looking at LinkedIn and it's from Shweta Singh.
Oh, okay. Oh, yeah. That's so nice, Shweta. Thank you for that. That's so nice.
Okay, well, we're at the end of the interview. I want to say a huge thank you for again participating in this live stream and also working through some of the technical challenges that we encountered here.
Yep. Never a dull moment, right, Brian? So
Yeah.
that's the thing. You can have some hiccups, but just be resilient and it'll work out. And then you'll have a great conversation with a former grad student, just like we did tonight.
All about adapting. But thanks again. Thanks everyone for tuning in as well. And we'll see everyone on the next episode.
Great talking to you, Brian. Good luck with the rest of the LinkedIn Accelerator program. Thanks for having me.
Thanks.